no salta, ninguém marca, fica parado. Finge parta, mexe seguro. Subi, deixe, subi. Ninguém marca, fica parado. Pula no caminho, faz flexão. Ninguém marca, fica parado. Na rua ou na praia, até dentro da casa. Ninguém marca, fica parado. Cabo Verde no estúdio, fachada de baú. Ninguém marca, fica parado. Na preguiça de cabeça, saúde de interessa. Ninguém marca, fica parado. Mexe, 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 mexe. Ninguém marca, fica parado. Mexe, 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 mexe. Ninguém marca, fica parado.
This is my first time in the assembly. This is my children, my boy, Addison. Fala, bom dia.
Bom dia.
Obrigado.
mesmo por aí. Esse nem encontro gosto. Essa fala que eu gosto.
Fica entrando poder anunciar. Está quase. Então espera, só no sinal para o Primeiro-Ministro vir direto para aqui. Senhoras e senhores, a vossa atenção para a entrada na sala do Sr. Ministro da Saúde, da Diretora Regional de Saúde e do Sr. Primeiro-Ministro. Minhas senhoras e meus senhores, mais uma vez, boa tarde. Depois de 2 dias de intenso
After
trabalho
2
e
days
acurado
of
debate,
intense work and great debate, we have come to the end of the second WHO Africa Health Forum. An important document is going to now be read by the Health Minister Arlindo do Rosário, who will then say a few words about this event. A very good afternoon. With the permission of the Prime Minister, I am going to read the communiqué, the second WHO Africa Health Forum held here in Praia, Cabo Verde. The second World Health Organization Africa Health Forum was jointly convened by the World Health Organization Regional Office for Africa and the government of Cabo Verde in Praia, Republic of Cabo Verde, from 26 to 28 March 2019. It was a follow-up to the first Africa Health Forum, organized in June 2017 in Kigali, Rwanda, which committed to putting people first, promoting synergies and coordination, and engaging all stakeholders behind the goal of achieving universal health coverage while leaving no one behind. Organized under the distinguished patronage of His Excellency President Jorge Carlos Almeida Fonseca and His Excellency José Luís Correia e Silva, Prime Minister of the Republic of Cabo Verde, the forum was attended by a broad range of participants, including high-ranking government officials from ministries of health and other sector ministries, parliamentarians, civil society and youth representatives, the media, agencies of the United Nations system, as well as other stakeholders. The theme for the forum was Achieving Universal Health Coverage and Health Security, the Africa we want to see. The theme underscored the central role of good health and the importance of ensuring health security and universal health coverage for the continent's development, sustainable development. The forum also highlighted the need for strategic partnerships, effective engagement, and coordinated joint actions for better management and mitigation of the urgent and ever-changing health needs of African populations. The key thematic areas for deliberation during the forum were taking universal health care to the next level, optimizing multi-sectoral partnerships for effective collaboration to improve health outcomes, ensuring health security and promoting innovation for the achievement of universal health care. The following are the main recommendations of the forum. On the need to take universal health care to the next level, member states should intensify and continue to implement the universal health coverage strategy as an effective way to guarantee the right to health for all without financial constraints, thereby contributing to the social well-being of their populations and to the achievement of the Sustainable Development Goals. Continue to strengthen national health systems, focusing on the primary health care strategy as the preferred pathway to achieving universal health coverage, as reiterated in the Declaration of Astana on Primary Health Care. Ensure active community participation in deciding and monitoring the effects of health initiatives, mobilize additional funds and improve the quality and efficiency of investment to accelerate and intensify efforts focused on universal health care. Governments and partners should actively monitor the range of essential health services available to each age group in countries to ensure that citizens enjoy greater access to the services they need for their health and well-being. Prioritize initiatives from communities, facilities and districts to build the resilience of health systems, to ensure sustained provision of essential services. Support the expansion of health promotion, disease prevention, curative, rehabilitative and palliative interventions, particularly for the populations that are currently left behind. Proactively support the generation of data and statistics needed to monitor progress towards universal health care in member states and make adjustments as necessary. Move away from payment at the point of use, because it is associated with inequities and financial barriers to access services. On the need to optimize multi-sectoral partnerships for effective collaboration to improve health outcomes, member states should promote inter-country stakeholder dialogue and public-private partnerships, including with intergovernmental organizations, the private sector, development banks and regional economic communities, local authorities, research institutions, and academia. Strengthen public-private partnerships for health and well-being at all levels of government and across key partner agencies to enhance health promotion policies, prevention policies and actions. Engage with and ensure the meaningful participation of the citizenry, including the youth, women and other vulnerable groups, in the development of policies and strategies affecting their health and well-being. Support local government and community structures to address the determinants of health and health inequalities to ensure that no one is left behind. Invest in gathering and using the strategic information needed for advocacy, planning and monitoring of programs for adolescent and youth health. Work to reduce policy barriers that limit access for young people and other vulnerable groups to health information and services. Governments and partners should continue to promote health in all policies and support cross-sectoral and intersectoral policy coherence and actions in order to address the determinants of health and to improve the health and well-being of the population. Empower the health sector to effectively engage and support the other sectors to incorporate health in all policies in their processes. The WHO and other agencies of the UN system should work with member states, development partners, and financial institutions to harmonize and integrate policies, strategies, and high-impact interventions while expanding efforts to reach the most vulnerable populations and improving equity. Support member states in mobilizing funding and improve the quality and efficiency of investments to strengthen multi-sectoral and community engagement and scale up new innovative tools and approaches. Engage heads of state in championing a systematic and coherent multi-sectoral agenda for addressing the key determinants of health in their countries. Support private and public sector investments in health promotion and primary prevention. Provide evidence-based guidance that supports healthy choices and interventions while applying the WHO framework of engagement with non-state actors. On the need to enhance private sector engagement for universal health care and health security through evidence-based actions, member states should put in place an enabling legal and policy environment and instruments that regulate the engagement and role of the private sector in universal health coverage and health security. Create and institutionalize forums for ongoing dialogue between health sector partners and the private sector. I'm going to shorten this text, which is huge, on the need to ensure health security. Member states, WHO and other agencies of the UN system and partners should promote full implementation of the International Health Regulations, which is 2005, and strengthen cross-border collaboration. Propose a mechanism with clear, actionable next steps for improving collaboration and coordination for public health emergency preparedness, response, and global health security at national, regional, and global level, taking into account the One Health approach. Define the roles and responsibilities of the different stakeholders, the WHO, the Africa CDC, international and national NGOs, international agencies, bilateral and multilateral funders, academia and researchers in supporting countries to fast-track the achievement of health security. Agree on an integrated mechanism with clear timeliness for formulating a resource mobilization strategy for sustainable domestic and external financing to support the implementation of the National Action Plan for Health Security using a phased and focused approach among and within countries and ensure its linkage with sector plans. On the need to promote innovations for the achievement of universal health care and health security, member states should provide fiscal and non-fiscal incentives to support the development of health innovations, support the development and implementation of innovation-friendly policies, develop effective strategies for incorporating innovations and new technologies into health sector interventions, institutionalize the use of GIS technological innovations to monitor and accelerate progress towards universal health coverage, including preparing for and responding to health emergency. WHO, partners and private sector should play a leading role in harnessing and supporting the scale-up of health innovations from the African continent. Identify, document, and share best practices across countries, including lessons learned from interregional, South-South, and triangular cooperation in order to foster a culture of innovation internally and externally. Continue to promote technological integration and innovation in health among member states, including showcasing exhibitions on innovations during high-profile meetings and conferences. The forum also recommended that member states, partners and donors accelerate implementation of the Kigali Call to Action to achieve the triple billion target of the WHO 13th General Programme of Work as adopted by the 71st World Health Assembly. During the closing ceremony, the forum extended its sincere gratitude to His Excellency Jorge Carlos Almeida Fonseca, President of the Republic, His Excellency José Ulisses Correia e Silva, Prime Minister, and the government and people of Cabo Verde for successfully hosting the Second Africa Health Forum. The forum requested the WHO Regional Director for Africa present this communique to the 69th session of the WHO Regional Committee for Africa. In line with the decision taken during the first WHO Africa Health Forum, to hold the forum every 2 years, the next forum will be held in 2021 at a venue to be determined. This is our forum communique. Thank you.
Muito bem. Eu passaria.
I will now give the floor without further ado. I will say rather a few words now before I give the floor to the Prime Minister.
Your Excellency, Prime Minister, WHO Regional Director for Africa, Dr. Moeti, colleagues, members of the government, distinguished members of the health participant here, members of Parliament of Cape Verde, the coordinator of the United Nations Agency System in Cabo Verde, the representative from Luxembourg, WHO representative in Cabo Verde, presenters, dear participants, ladies and gentlemen, it is a great honor to have with us at this closing ceremony His Excellency, the present Prime Minister, signaling his and his government's commitment to issues of health nationally, regionally, and globally. Thank you very much. Regional Director, WHO, Afro, my sister, Dr. Moeti. Our thanks and deep appreciation also go to you for your work and leadership in improving the health of people on our continent. Once again, we reiterate our commitment to WHO to continue with this collaboration, which we began in 1977. Together, much has been achieved. We have reached the end of the second WHO Africa Health Forum, this time organized by the WHO, co-hosted by us and Cape Verde. Given the importance and pertinent contributions of this forum, allow me to express my deep conviction that it is indeed the start of a process which will continue until we fully achieve our common vision. The vision of an Africa able to express itself and stand firm before the world, in which its immense potential will find the time, space, and opportunity to thrive. An Africa definitively focused on health, just as there is no space for cold where there is heat. Let us work for a place where health occupies so much space that disease, if it emerges, can only occupy the least space possible. Is my statement too poetic and rhetorical? Perhaps. But, dear ladies and gentlemen, What is rhetoric if not the language of the soul, expressed through a body that needs to be nourished and cared for through concrete actions? Let us ensure that our wishes and aspirations may be achieved through truly effective actions in Africa. May the excellent exchanges of experiences of the last 3 days, as well as the relevant recommendations to come out of this forum, bear fruit through what I would like to call the prior commitment. It is that commitment that will continue to connect us, giving meaning and long life to this forum. Yes, it is possible to achieve UHC. Is it possible to achieve health, security in Africa? Yes. Is it possible to have healthier Africans? Yes. Is it possible to realize the dreams expressed here by our youth on the magnificent panel on their contribution to the Africa we want? Yes. Is it possible to fully appreciate the intelligence and innovative spirit of our young inventors and scientists on display in the stands during the 3 days of the forum? Yes. We do believe it is. This is our commitment. This is our commitment of prior. I would like to end this short address in this way. Thank you, partners. Thank you, ministers, for your participation and engagement. Thank you for the brilliant presenters, for your contributions. We will all leave here much richer. Our deep appreciation goes to the moderators for their energy, which encouraged lively interactive participation. Thank you to all our distinguished national and international participants for your contributions, which allowed us to take this event to the next level, to the highest level. Thank you to all who one way or another contributed to organizing, staging, and supporting this event. Thank you to the team of translators and interpreters, and congratulations for your excellent work. Thank you, WHO, for the honor and opportunity to share in hosting this forum. Undoubtedly, Cape Verde received more than it could give, but we believe that it is clear that the greatness of the small state, Cabo Verde, lies in the realm of the intangible, an intangible filled with morabeza, fraternity, and the unlimited belief that through work, effort, faith, and focus on people, putting people first, we will continue with our humble contribution towards Africa we all want to see. I wish you a safe return home, and please keep coming back. Thank you very much. We now have the pleasure and honor to announce the closing address of the Regional Director for Africa, Dr. Moeti.
Your Excellency, Jose Ulysses Correa Silva, the Prime Minister of Cape Verde, my dear brother, Dr. Arlindo Nascimento, Minister of Health and Social Security, Honorable Ministers of Health and other sectors, dear partners from the UN, from bilateral organizations, civil society, academia, young people, our staff from WHO, thank you so much for such a wonderful, amazing forum. Dear Prime Minister, first through you, I'd like to again reiterate our sincere and profound thanks to Mr. President for having joined us here and for having so warmly accepted to host this meeting here in Cape Verde. As I said at the beginning, that didn't happen by accident. We deliberately chose to come here because we knew that we would find much to learn, first of all, from the progress that you have made in improving the health of Cape Verdeans. And secondly, a wonderful hospitality, an amazing environment in which to do our work, which inspired us so much. In my exchanges with various people, including some from West African countries not far away, they were happy to have the opportunity to finally come to Cape Verde. And they've discovered this beautiful country, its hospitable people, the warmth that pervaded everything that we did here, our interactions with the culture, which is so rich, and very much, I have to say, from my own point of view, my interaction with the cuisine and the wonderful fish that I ate with enthusiasm every single day. It has been, indeed, a wonderful experience to have come to Cape Verde. I won't be very long because my brother Arlindo was so eloquent. That's a hard act to follow. I echo very warmly and sincerely everything that he said. I'd like to say that we did learn about what was done in Cape Verde. We learned very much about translating political commitment into good governance, translating resources that may not be of a wealthy country into tangible results in the type of health impact that you've had in Cape Verde and the life expectancy of a population that we would normally expect to find in a wealthy country. We learned about how you engage communities in a number of ways, in a variety of programs here in Cape Verde, so that the people really do play their role in health. And we learned very much about how the various sectors are engaged in working together. And I have to say that these were themes that ran through the program that we had developed for this forum, and were reinforced each and every time during the sessions that we listened to. I was very happy, and I'd like to emphasize this, that we had the participation here of the private sector, and an extremely productive, engaging session on how we can work better with the private sector, how to leverage the capacity, the resources, not only the financial resources, but the strategic capacity of people who have to always be looking at the bottom line and looking at value for money, and what we can learn from some of your approaches. I'm very happy that we've agreed we're going to take forward this dialogue and translate it not only into discussion, but also into concrete actions together. We in WHO and our partners working on an aspect of supporting work with the private sector, we're very happy to learn from some of what we are doing. So what are some of the key observations that I made coming out of the discussions that we had? Indeed, there is a momentum on universal health coverage on the African continent, and there is also a momentum on improving the preparedness and readiness of countries to face up to outbreaks and emergencies. This emerged very strongly. I am very encouraged that we are building on decisions that our political leaders have made, which they are translating into concrete action, and this was revealed here in many of the discussions that took place. What else is happening? We discussed a lot, linkages, synergies, integrating what's happening and reducing the division, fragmentation, and the silos. This emerged for me as a theme in many of the sessions that we held. And we will have to find ways to harness that into tools, strategies, ways of working, and ways of evaluating how our countries are making progress with the help of all of us. Very humbling for me. We reiterated the importance, the centrality of people and the community. And I'm humbled because I had to be reminded by a male social anthropologist of the importance of women in establishing community surveillance systems in countries. So that, I would like to promise, is something that we will take into the guidance of WHO. It will not remain as rhetoric in a nice session that took place here. How can the surveillance systems that we keep talking about, community systems for health, become a reality in our countries? And you reminded us that women are at the center of all of this. We've taken that on board, and we will make sure that it happens. Among the work that our mainly male colleagues are implementing, this is who we have in the organization, and as a female leader, I will make sure that we take that very much on board. We very much talked about monitoring, evaluating, and here I'd like to add a comment that a friend made to me. What can be the engagement of communities in holding all of us accountable on a day-to-day basis as we implement the programs and the commitments that we make in our national plans, in our WHO plans, in everything that we say we will do. Again, we will do something about making sure that in our engagement with ministers at country level, we encourage this, we create the space for it, because we believe it can only be value added. I'd like to finish by saying we did indeed have wonderful panelists and wonderful moderators, some who came from very far away. One of our moderators had traveled from Hong Kong to London, where she literally changed her bag, jumped into another plane, and journeyed to Praia. So we appreciate very much your understanding, the fact that you were so responsive when we asked you to join us, and we appreciate the value added of your skills, your expertise in animating extremely productive discussions. Thank you very much for having joined us in this forum. The young people asked us again about a participatory way of working with them, not only engaging them in conferences, but giving them space when we get back home so that their energy, their creativity can be an integral part of our day-to-day work on health in our countries. Our ministers listened very closely, I know, occasionally made extremely wise comments, meaning they understand the important and central role of government in leading, in creating the regulatory, the policy environment that enables all of this work and these good ideas to be implemented. One minister said, when we spoke about financing for health, that we have to acknowledge that we do need to increase the allocation of domestic resources for health. I think that is a given, and we've agreed to all work together with all the data that we have to continue to make the case, to become more skilled in the language, as somebody put it, of finance ministers, so that our words will find a receptive ear. But it was also said we need to do more with what we have. We need to get better results with the resources that are already available, not only in terms of financing, but very much the human resources that already exist in our systems in order to deliver the improvement of health that we wish for, which means we need to look at efficiencies. We need to look at less fragmentation and duplication. We need to bring the resources together. One of the participants, one of the deputy minister from Guinea said, we also need to influence those who provide us with funding so that they align to our priorities, and very much their way of financing health reduces the fragmentation, helps us to make better and more efficient use of the resources that they bring to the health sector. So I hope that that message is heard, and this is something that we will continue to promote. I'll conclude again by thanking all of those who did such a fabulous job in organizing this, this forum, starting with our country team here in Cabo Verde, Dr. Mariano and the country team staff who worked so hard day to day, and working with the Honorable Minister and his team on a day-to-day basis. And I'd like to thank my colleagues at the regional office who led different themes in preparing, and Joseph Kabore, my deputy, who corralled all of us together frequently to say, where are we with this? And your panel is not really shaping up. And can you remind them and confirm that they are coming? It was really a fantastic collective effort, and I very much appreciate the support that I received in organizing this meeting. So thank you all for having come to Praia. Thank you to our local participants from Cabo Verde for having so generously shared what you have done, what you've achieved. And I'd like to say we will see you in 2 years' time at a venue yet to be determined. And by then, I'm sure we'll be reporting even further progress in taking forward all of the discussions that we had here as concrete achievements and contributions to the improvement of African people. Just to remind you, as the regional director, I owe the global community the contribution of our region to the 3 billion that we talked about. This is our collective endeavor, and I'd very much appreciate that we work together to deliver it. Thank you all so much. Thank you.
E para proferir o discurso de encerramento, convidamos o Dr. Ulisses Correia Silva, Primeiro-Ministro de Cabo Verde.
Muito boa tarde a todos. Senhor Ministro da Saúde de Cabo Verde.
Minister of Health of Cabo Verde. Ministers and distinguished heads of delegation. WHO Regional Director for Africa. Representatives of the Diplomatic Corps. Participants. Dear ladies and gentlemen, I welcome the holding of the WHO Africa Health Forum in Cape Verde, and in particular the recommendations that emerged from the lengthy work done here. I hope you felt good in Praia and enjoyed your stay here. And I hope that you will come back for work, with your family, on holiday. You will always be welcome. You will also always be warmly received. We are grateful for the choice of the city of Praia to host this important event. That demonstrates the trust deposited in us by the World Health Organization. I would also like to pay special tribute to the Regional Director, Dr. Moeti. I wish you the greatest of success in carrying out the most noble of missions for humanity, providing health, without which people could not possibly achieve any of their other life goals or the goals of their nations. The Sustainable Development Goals tell us that we should leave no one behind. This is imperative for health. It is a public responsibility that has an impact on the quality of life of citizens, on productivity, and on the competitiveness of nations. The WHO is a reference partner for the development of health in Cape Verde. It has always been that, and I'm sure it will continue to be that. We want to further strengthen that partnership. Cape Verde has done its utmost to produce political reforms and invest in health. And this has had a positive impact in terms of life expectancy and also in terms of the quality of life of all people. Our aim is an ambitious one. We want to make sure that Cabo Verde is among the 10 best placed small island nations on the Human Development Index. As such, health and hygiene are decisive. Education, accessible and quality education, and the increase in per capita income, which we want to double until 2026, are fundamental. We want to leave this legacy to this generation and the next, to give them a healthier life, opportunities for all. We have been able to eradicate polio. We did this in 2016. In the next few years, we have to eradicate malaria, mother-to-child transmission of HIV, measles, rubella, and congenital syphilis. The country's reduction of maternal and infant mortality has been very good, and we're going to continue to improve. We're an archipelago, and so there are great investment challenges. The challenges are different to those faced by continental nations. Investment in health infrastructure is required across all our islands, but they need to be complemented by better air and maritime links to promote mobility, but we also need technology like telemedicine, which allow for access to long-distance medical service. We need To extend the coverage of social security, we need a productive, inclusive policy focusing on self-sufficiency and autonomy of families. We need to extend care to the most vulnerable populations, children, the elderly, the disabled. All of this is important, and we have been working diligently on this to produce positive impacts on the quality of life of people and also on the quality of their health. Healthy cities, thanks to the generalized practice of exercise, of physical activity. Fighting tobacco and alcohol are also ways in which we produce positive impacts on the quality of life and prevention, because we are promoting healthy practices and behaviors. In many countries around the world, and also in Africa, universal health coverage and health security are challenges that we have ahead of us. But we believe that if there is political and civic awareness, if there is dedicated political leadership, if there are good initiatives, good regulations, good development partnerships, favorable conditions for investment and private activity in the health sector, conditions that will promote innovation and creativity, we will be able to rise to the challenge. I conclude wishing you all a safe return trip home. Please come back again. Please know that we would like you not only to work, but also to get to know Cape Verde a little better. And let Africa meet all the challenges it has ahead. We need good partnerships, good investment, strong and assertive political leadership. Thank you all. Ladies and gentlemen, nothing further needs to be added today. I wish you all a good return home. Enjoy the rest of your stay if you're staying on. And above all, I wish you all the best of health.